Hi, I'm Dr. Michael Alvarez. Are you having issues with snoring? And is your snoring making you unpopular with your spouse or family members or roommates? In this video, we're going to discuss the basic reason that your doctor may refer you to a dentist for sleep disorder problems. Listen, as a patient of mine, Wayne, asks the common questions I'm asked by my new patients. Good morning.
Good morning.
Great to meet you, Wayne. How are you? I'm Dr. Alvarez, and it's good to meet you.
Well, I want to know, what am I doing in a dentist office for my sleep problems?
I am a specialist in this work. I've been doing this work over 30 years where I help people who have sleep and breathing problems with oral devices. I don't use surgery and I don't use drugs to help you with this.
Well, the doctor, I went to see him now, all of a sudden, I have my specialist, have my test, everything. What am I doing in your office?
Well, your doctor thought that your treatment would be best suited with a dental appliance, so they referred you to me, and I make custom-made dental appliances that help you breathe better at night and even during the day.
Well, okay, how's that going to help me, and is my insurance going to pay for that?
Because your doctor referred you here and sent a prescription for a medical problem you have been diagnosed with, sleep apnea, I can bill your medical insurance for this treatment. We have specific codes, medical codes we use to get reimbursement for you.
So what's the process?
The process is you went through this sleep study, this very extensive study with all these pages, all these electrodes you had on, all night long they're measuring different functions. We'll review that sleep study. We'll get to the bottom of it. We'll look at every line so that you can better understand this diagnosis of sleep apnea. After we've gone through the sleep study, I will do a complete oral dental exam and look at the anatomy of your mouth. What contributes to the problem of snoring and sleep apnea in your makeup of your mouth, your throat. After that, my assistant will come in and take impressions of your teeth. I will do a special registration of the range of motion of your jaw to see what range your jaw moves. And then I'll measure it and I'll index it with a wax bite registration.
Well, then what?
Then we can construct the custom-made dental appliances that you need.
Well, how much is this going to cost me out of my pocket?
Well, we don't know. Every medical insurance has different coverages. The best we can do is what you have, your referral slip, your prescription from your doctor, a sleep study with this diagnosis. We'll send it to your insurance company for reimbursement. My staff has been working with many medical insurance companies. They can give you more information about what kind of reimbursement they generally get from your insurance plan.
Would you have a success rate with this appliance you're talking about?
Yes, we have been studying oral appliances now for over 20 years. The Academy of Dental Sleep Medicine was founded under the name of Sleep Disorders Dental Society. I was one of the founding members. We have been doing studies on oral appliances since then to prove that oral appliances work for treating sleep apnea and snoring problems. We overall, in 1995, we had a study by the journal Sleep where the medical doctors looked at all our research, and there was over a 70% success rate overall with oral appliances for treating mild to moderate sleep apnea.
Well, one of the doctors I saw said I needed something called CPAP. Is this going to work with this CPAP?
This has always been our issue, is what people come in with. They have history of different treatments. Some people have had surgeries done for sleep apnea. Other people have been given machines that are non-surgical, but they have a mask they wear at night, and air is forced in their nose or mouth or both at night at certain pressures to keep the throat open. Now, compliance is our biggest issue, and success rate is our biggest issue with surgeries. And many people who come to see me have not been successful with surgeries, or they cannot comply with the CPAP system because of the pressure, because of the leaks, because of claustrophobia, because the material the masks are made out of. So we're here to offer another alternative that works like CPAP.
Okay, I'm real nervous and anxious about this. Is there anything else that you can tell me that would help me, to be encouraged to try this?
Yes, not only success rate, but this is a simple device that you wear at night, like retainers. And all it does is gently hold the jaw forward or open the mouth so the tongue has a place to come forward. The tongue is our biggest culprit in dealing with snoring and sleep apnea, the position of the tongue. So that's our main goal, is to guide the position of the tongue, not just the back of the tongue, the front of the tongue. So you'll see that this immediately, you'll feel the difference after you place the appliance in. I hope that you enjoyed the video. It is my sincere desire to help anyone with sleep disorder issues. My office has helped people all over the San Francisco Bay Area. Please contact me now if you are suffering with any sleep disorder issues or just plain want to stop snoring.
Please contact the office of Dr. Michael Alvarez at 510-470-7972 or on the web at www.stopsnoringsleepingdisorders.com. Don't suffer any longer. Contact us now at 510-470-7972 or on the web at www.stopsnoringsleepingdisorders.com.